I think from my point of view, the most powerful contribution that governors have been able to make to people mental health and wellbeing at school is making it high priority. It really has become part of our culture from top down. And because it is always a standing agenda item, everything we do has that as a consideration, along with the health and wellbeing of the staff as well. When we have, for example, a finance meeting, the question will be asked as to what else do we need financially? What are we spending money on to support our pupils' mental health and wellbeing? We have coaches that come in and we buy their time depending on the needs that our children have. So our governors will perhaps challenge us on how we know what those needs are. Are we missing anybody? From a strategic point of view, are we putting enough funding into that? Is it having the greatest impact? What is that impact? Have we reviewed it? Are we using research to underpin our practice? So I think really from my point of view, it's been their absolute commitment through every single strand of their work. And actually that then is a huge support to us. We're not fighting against them. We are being driven and supported by them. We've involved governors in pupil mental health and wellbeing provision in school in a variety of different ways, but we actually focused on 6 key areas. So we focused on the profile of mental health, the culture within school, training, ethos, recognising and responding to what was going on, but also policies and procedures. So our governors helped and supported us in developing the profile of mental health and wellbeing in school. So we have a mental health and wellbeing governor who's trained and actually comes into school. The staff are aware that she's there and she works quite closely with us. We also made sure that on every single governor's meeting, subcommittee meeting, mental health and wellbeing of staff and pupils is a standing agenda item so that the governors can ask questions about what's happening in school. And the governors refer to any provision on any of their visit reports, which obviously is a bit tricky at the moment because they can't physically come in, but they are zooming in with their class teachers. Each governor is attached to a class teacher and having a chat with them about what's happening within their subject areas and within their classes. So we've also involved our governors with our culture, and they've actually made a powerful contribution by giving mental health and wellbeing really high priority through every aspect of their work as governors. So the governors have been involved in different initiatives. We've had kindness initiatives. We had Pots of Joy where the children decorated pots, planted flowers and delivered them to people in the community as well as our governors. But governors question us, challenge us, talk to us about mental health and wellbeing through absolutely every element of their work. The governors has received training in the governance of a mentally healthy school, and some of that work we did through the Charlie Waller Trust, but also we've done ourselves. And they've thought a lot about what questions they should ask of senior leadership, how they should challenge us, how they should talk to us, what their expectations should be of us. We did an awful lot of work, a huge project around our ethos, and our governors made a really powerful contribution to that, to give mental health and wellbeing a really high priority through every aspect of their work. So we actually rewrote our ethos and vision together with our governors, our children, our families, and made sure that it really reflected what we wanted to achieve with regards to mental health and wellbeing. We asked that governors challenge us on our ability to recognise and respond, so check how school is responding to mental health issues from a strategic level, and to challenge us on that to make sure that we are responding both to staff and pupil needs, responding to data and information that we share with them, and being prepared to direct finances and amend policies in line with what we want to achieve, and challenging us on that as well. So all of our policies and procedures link to mental health and wellbeing. All of our curriculum policies have a paragraph about looking after staff mental health and wellbeing and supporting children through the curriculum. Because our ethos is underpinned with mental health and wellbeing, we use our ethos when we are recruiting, so that the health and wellbeing of our staff and pupils is a focus within recruitment. As I said before, our governors are constantly considering and talking to us, challenging us on how we're meeting the wellbeing needs of staff and children.
So I'm going to share a brief overview now of the AcSeed Award that we've just achieved as a school. And it's something we've recently done over the last 12 months, and a really successful approach for our governors and all our school staff to work together on. The AcSeed Award is a quality assurance mark. It's free for schools to access, so there's no outgoings with finances, and it supports all the mental health needs, looking at your community, your school community, your staff, your pupils. It's that whole approach, and that's something we've adopted in the school really heavily. We've got 3 parts of the assessment. So we have the initial assessment where governors and staff work together to look at our starting point. You're given a really clear strategic plan to look through and seeing what is a good practice, what's best practice, and where you fit in that plan. So then you can plan forward as a governor, as SLT, about where your gaps are and what you need to do. We found that a really powerful tool. So the self-assessment criteria provides all the stakeholders of an overview of best practice. This is what you're given when you first do the AcSeed Award. You're given a document with all the areas of mental health linked. Again, it's that conversation starter, and it's a good opportunity for everybody to work together. You'll notice on the screen now there's lots of bits highlighted where it says governors, and it's talking about the governor's approach to mental health and what they need to do. So if you're a new governor that's never maybe looked into mental health before, a little bit unsure, it's a brilliant document to access. It's free online, you can go and download it, and you can see what your role is in helping your school. And I think that's one thing our governors really appreciated. It's split into key areas, and each area has links to those roles of the governors. Through this opportunity of the AcSeed Award, it's given us lots to look at. It's given us the opportunity to work with wellbeing with our governors, something we've never done really strongly before. It gives us the opportunity to ask questions of each other in relation to that framework that we were given. It gives us accountability because we had something to work towards. It gives the governors accountability, and I know as a subject leader they had asked me to provide termly reports to the governors so that I could let them know how we were getting on term by term and where our progress was going. And it gave me a link to those governors that maybe I wouldn't necessarily have spoke to on a regular basis. It gave me an opportunity as well to work with the governors on a strategic plan, something that linked into the SLT, your ethos, your finances, and all those other little divisions within the school. It was very appropriate, we found, for all age ranges. So we're an early years setting here at Kingmoor. We found schools right up to colleges using this, and governors find it as a really successful tool to start them off on the mental health journey. And there's lots of mental health approaches around, but they're quite costly. We found this one off word of mouth, and it worked really well for what we wanted and the governors wanted in our school. And as I say, it didn't have that financial impact on us where it was a lot of money to hand out straight away. So it's been helpful, but it is nationwide, and it is right from earlier settings to colleges. As a subject leader and a teacher in the school, it's been so good to have governors that are interested and just want to ask questions. It's not been something that's been off-putting. Not often do you get to see your governors or speak to your governors, to have the opportunity to be asked questions, for somebody to be interested in what you're doing, for somebody to be interested in how they can help you as a staff or as a teacher, or how to help your children. It's been an amazing opportunity really for the mental health, and the governor has been so in-depth and so knowledgeable and so interested to learn more. And I think we've worked really closely in learning from each other. We've learned a lot from our governors, and hopefully they've learned a lot from us. It's been a nice opportunity to develop that relationship, hasn't it? The governors just need to ask questions, get interest, get in there. I think everybody in the school just appreciates that opportunity to be able to work in collaboration, really.